Hello, my name is Jennifer Popchak-Hakeem from the Office of Forensic Mental Health Services under DSHS.
And I'm Maureen Bailey. I work for the Healthcare Authority. I'm the Enhanced Peer Services Program Administrator. And I would like to welcome you back to the series of the intersection of behavioral health and the law. And we're covering Module 10 today, Crisis De-escalation. So if you could pull out your manuals and turn to Module 10. So what will we cover in this module? And just as a reminder, these are overviews of the modules for the in-person training. So we will not be going in depth, but we'll go over what will be covered in the in-person training. So what will you learn in this module? We'll talk about what is a crisis. We'll talk about some indicators and triggers. We'll go over some concepts of crisis de-escalation and crisis intervention, and some of the different types of interactions. So because this module offers a high-level view, following specific techniques and trainings by your organization should provide you with the focused knowledge and skills needed in your particular area of expertise. So please always follow what your agency guidelines are. So what is a crisis? First off, crisis is individually defined by everybody, but we're going to go over what is defined in a crisis here. So what a person is experiencing exceeds their ability to cope. Feelings and actions and behavior that can lead a person to hurting themselves or others. Crisis is when a person is unable to function in the community in a healthy manner, and they can be exhibiting acute psychotic symptoms.
So, Mo, I'm going to quickly share a
Okay.
few statistics that are kind of interesting here. So, in psychiatric settings, injury and illness rates due to violence in the workplace by patients are 69 times higher for psychiatric aides than the national rate of workplace violence, and 38 times higher for psychiatric technicians. Law enforcement and corrections officers also experience high rates of violence. Between 2005 and 2009, they were two of the four professions with the highest rates of non fatal workplace violence. Direct experience with violence can also contribute to a higher risk of suicide and increased trauma exposure.
So this is why we want to cover crisis de-escalation. We want to avoid those interactions that are negative. And we also want to point out again that just because somebody has a behavioral health condition does not mean that they're violent individuals.
I think it really does underscore the importance of recognizing a crisis and trying to intervene prior to it escalating.
Great. Thank you, Jennifer.
Sure.
So what are some signs that a person is in crisis? So somebody could be having difficulty communicating their thoughts, their feelings, or their needs. They could be showing aggressive behavior that may also be linked to their difficulty in communicating. And they also might have a difficulty listening to other people, so they're not taking in that information. So signs that a person could be nearing crisis. So there's the inability to perform daily tasks. They might be having rapid mood swings that are different than normal, increased agitation. They could be showing some unpredictable outbursts, showing some abusive behavior. They could be isolating more, showing signs of paranoia, losing touch with reality, showing increased hostility, and also showing like an angry stare. That might be a sign that a person could be nearing crisis. So what might lead to escalation? And I want to point out and just remind everybody that we're all unique and we all have had different life experiences, and how one person reacts may be totally different to the next. So it's all individual. So what are some individual factors that we want to take in consideration for? So if a person has a history of trauma, and again, many of the people that we will be supporting have a history of trauma. Psychiatric symptoms, that is a big factor. Some may have organic brain disorders that we covered back in Module 4, medication, substance use, and their lack of coping skills at that time. So what are some triggers? So triggers could be a person is feeling unsafe, powerless, or at a loss of control. Again, that inability to communicate, unmet needs, It could be a new change in environment, could be a lack of personal space. Right now, we're all having a lot of personal space, but there are times when we don't have enough space to ourselves, and that could also be a trigger for somebody. A jarring or different noise could also trigger somebody. And again, reminders of past trauma. We all have our personal lived experience and history. Everybody does. And sometimes those past reminders really come to get us. So those are some triggers we want to be aware of. So, what is crisis de-escalation intervention? So, de-escalation is a process of reducing the intensity of a conflict or a potentially volatile situation. And so, the intervention part is the immediate and short-term care to assist a person in crisis. Again, we cannot control what happens, we can only control how we respond. So, what can we focus our actions on? So, we can focus our actions on what we can do and only what we can do. So, our posture is really important, how we're perceived by the other person, our proximity and distance, our voice, so our tone and volume of our voice, the use of command statements, how we focus on a person's feelings, our response, and how we can allow for silence and allow for time for decisions. If we come from a non-judgmental point of view, that really helps. How we can avoid overreacting and increasing the escalation, and that we can be empathetic. So you had something you wanted to add, Jennifer?
So I just wanted to say our instincts might tell us to react defensively to the level of energy and emotion that somebody else is pouring out in front of us. But the best thing we can do is to take a mindful pause, however slight, and realize that we've been there too. We've all felt incredible pain, overwhelming stress, or been overcome by an indecipherable wave of emotion at some point in our lives. It's what makes us human, and that humanity is the same thing that makes us capable of safely and effectively de-escalating a person or a situation away from crisis.
Again, so just recognizing that we're all human beings, we all have moments of crisis. And again, it's how we react to the crisis is what we can control. Thank you, Jennifer.
Mm-hmm.
So, what are some different types of interactions? Did you want to take it from here, Jennifer?
Sure.
Thank you.
So, some different types of interactions are listening. And again, we're talking about your response. So, listening, validating what the other person says, positive dialogue and body language. And that's very important when you first approach a situation. Think about your body language right from the get-go. Explaining consequences of behavior. So this leads to this, and maintaining boundaries. Remember, it's not personal.
Nope.
So listening and providing validation. Let the person know that you see them, you're listening to them, trying to understand their concerns. When a person is upset, and you can think about yourself a little bit, you always want to know that somebody's listening, that you're heard, and that you're being understood. So basically, provide that for this individual. How can we provide validation? Accurately reflecting what the person says, remaining non-judgmental. Some helpful phrases are when somebody relays information to you, you could say, in other words, it sounds like you are very upset. This must be really difficult for you. So those are kind of some pieces that could help you navigate that conversation. Yeah. Positive dialogue, speaking moderately. Don't rush through your words. Don't speak too slowly. Just moderate your tone, and using a calm tone and demeanor. And this part of this is inside yourself. Feel that calmness. Make sure you approach that situation with a calmness and try not to get caught up in the escalation of the situation. Clear language, speaking clearly, think in your head about bullet points, not trying to be overly verbose. Use non-threatening posture and voice.
And so I just wanted to add a little bit about that non-threatening posture and voice. So when we talk to somebody, we don't want to be talking with crossed arms. We want to be talking with uncrossed arms. We want our hands out of our pockets and not behind our back. And also just going back on using that calm tone and demeanor. I have a friend who, when I am upset, she can actually, just by her way she talks to me and her tone and her pace, how she just calms me down is amazing.
Yeah, and I would add on the non-threatening posture and voice too. If a person is sitting down, you don't want to be standing up.
Mhm.
You want to try to get at their eye level. So otherwise, it can appear threatening.
Most definitely.
Okay. So framework to move forward: explaining consequences of behaviors, maintaining boundaries, and setting limits. So once things have um, ramped down a little bit, you need to make sure that the person understands what is the consequence of this behavior that you're engaging in right now, and here are the limits and the boundaries.
And sometimes when we set boundaries, a lot of times when we set boundaries and setting limits, it actually gives a person a feeling of control. So they actually know what is going to happen if I do this.
That's a good point. Yeah. So here's a little chart about negative and positive prompting. So if we look at the goal, have the person move out of the middle of the lobby. Negative prompting would be, if you don't move to the side, you'll be removed from the building. I myself, hearing that, am kind of taken aback already. It doesn't sound good to anybody, right? So an alternative would be a more positive way to say this. After you move over here, we can continue our conversation. A second goal would be have the person stop yelling. So the negative prompt would be, if you don't stop yelling, I'm not going to talk to you. Kind of puts you on the defense right
And not
away.
very productive.
Yeah, not productive. So a different way of reacting in this situation would be, when you stop yelling, we can talk about what's going on. So this is what I need to see happen, and here's what will be the result of that.
And the positive prompts just are a more effective way to start a conversation and get a positive reaction.
Oh yeah, I mean, you can use this in your everyday life. Nobody wants to hear that negative piece.
Nope.
All right. So the importance of de-escalation, it can contribute to a safer, healthier environment for everyone involved. So you hear those statistics in the beginning, and if a situation gets to that and somebody's being injured, nobody's in a good place in that situation. So whether the statistics relate to the staff or the individual, it's not a positive situation for anybody involved. So
that's why we want you to pay attention to crisis de-escalation. And this brings us to the end of Module 10. And so we'll see you in Module 11.
All right.
Thank
Bye.
you.